Hello dear doctors, I Dr. Sayyida Sana welcome you in Anatomy Student Zone. I know after a long break I am here with you but was unable to upload lecture due to some reasons. I will be also waiting for your comments, suggestions and topic that you want in the future for guidance and that you want to be uploaded. This lecture is a continuation of a previous lecture that covered the first group of muscles of lesser pelvis. Second group that includes the levator ani and the coccygeus that were left. Before I tell you about the detail of these muscles, it's important to know about the pelvic floor and pelvic diaphragm. So there is a difference between pelvic floor and the diaphragm, and that difference is like floor of room is formed of tiles, cements and other material. Similarly, pelvic floor refers to group of muscles, ligaments and connective tissue. And the function of this floor is support the pelvic diaphragm at the base of pelvis. Pelvic floor extends from pubic bone at front, coccyx at back and the ischial tuberosities at side. Now I will tell you what is a pelvic diaphragm. So remember, the pelvic diaphragm is a bowl shape or a funnel shaped structure, and it is made up of just muscle, the ligaments and the connective tissue that are not going to form the pelvic diaphragm, just the muscles which are levator ani and the coccygeus. These are part of the pelvic diaphragm. Hence we can say the pelvic floor is formed by the pelvic diaphragm, that is a bowl shape, funnel shape or hammock-like structures that is made up of muscle. We all know that anatomically the pelvic diaphragm lies within the lesser pelvis and it separates the cavity of a lesser pelvis from the cavity of perineum. Hence it's also forming the roof of perineum as well. Now, my question is, what are the attachment of the pelvic diaphragm? For this, remember this hammock-like structure stretches between the walls of the pelvis, and the walls of the pelvis are anterior, lateral and the posterior wall that we have covered in the previous lecture as well. So it's important to remember that pelvic diaphragm closes a much of ring of pelvic girdle. But anteriorly this is deficient and there is a small area or a gap that is shown as black in this image, and we can name this gap as a urogenital hiatus. So anatomically where the urogenital hiatus is present, remember it is present between the medial border of the levator ani muscle on each side. So each side of the medial border of levator ani, in the center of this we are having a gap that is urogenital hiatus. As the name indicates, it gives a passage to the urinary and the genital structure. So the urinary structure is urethra in both sexes and the genital structure that is vagina in female. Now we will cover the detail of the muscle which are forming the pelvic diaphragm, and these are levator ani and coccygeus. First I will cover the levator ani and later on coccygeus. Levator ani is a broad sheet of muscle and this is shown as blue in this image. This muscle is larger and we can also see in this image as well, and it is the most important part of the pelvic floor. Levator ani is attached anteriorly to the body of the pubic bone, posteriorly to ischial spine, and on each side the thickening in the obturator fascia that we have already covered, and that was forming the tendinous arc. So levator ani originates from that tendinous arc. So this levator ani muscle is having three parts, and these parts we name according to attachment and the direction of fiber. So first part is the puborectalis. This is a medial part of levator ani. Another is pubococcygeus. This is an intermediate part, and the third is iliococcygeus. It's a posterolateral part. Now we will cover the detail of all three parts of levator ani. In this image, all three parts of levator ani are shown, and you can see the first puborectalis is shown as blue in this image, pubococcygeus as red, and iliococcygeus is shown as black. So puborectalis, as I told you, is a medial part of the levator ani, and we can also see it is a thicker and the narrower part. The muscle fiber of the puborectalis arises from the posterior aspect of body of pubis bone, and the right and the left pubic bones, these are giving origin to the direction of muscle of these fibers. After it arises from the pubic bone, it forms the puborectal sling. And what the puborectal sling is, it is a U-shaped sling of this muscle, and this sling passes posterior to the anorectal junction, and it plays a major role in maintaining the fecal incontinence. After covering the puborectalis, now I will tell you about the pubococcygeus that I told you. This is a thin intermediate part of the levator ani, and its fibers are arising lateral to the puborectalis, as we can also see. As the name indicates, pubo mean arises from the posterior aspect of body of pubis, and the coccygeus, as the name indicates, it is attaching posteriorly to the coccyx. So it is arising from the pubic bone and going to be attached on a coccyx. Remember, the medial fiber of the right and the left pubococcygeus, they merge with each other and they are forming a fibrous raphe or the tendinous plate, and we name this raphe or a plate as an anococcygeal body or a ligament. The extent of the anococcygeal body is shown in this image, and this is highlighted with a blue color in this image, and it's very easy to remember, as the name indicates. Anococcygeal mean it extends between the margin of the anus and the coccyx. So the third part of levator ani is iliococcygeus. Iliococcygeus is a posterolateral part of the levator ani, and this part appears, when we are going to see this part, it's more aponeurotic as compared to muscular because it's often poorly developed. But we can see in this image, this part arises from the posterior aspect of tendinous arc and the ischial spine, and then it blends with the anococcygeal body that I have already told you. So normally the levator ani muscle is having tone and it's contracted most of the time. Why this muscle is contracted most of the time? It's to support the abdominal and pelvic viscera. It is also contracted most of the time to assist in maintaining the urinary and the fecal continence also. So levator ani is also actively contracted during the activities like forced expiration, coughing, sneezing, vomiting, and when we are lifting a heavy object and we are flexing our trunk, and the strong movements of the upper limb are going to take place. So during all these activities that I have told you, we know there is increased intra-abdominal pressure, and for this reasons the levator ani muscle is actively contracted to provide support to the pelvic viscera so that they are not going to prolapse of these viscera and they are at their normal anatomical place as well. So remember another point as well, that during defecation there is increased intra-abdominal pressure for the defecation, and this is provided by the contraction of the thoracic diaphragm and the muscles of the anterolateral abdominal wall. So during defecation the levator ani muscle is not contracted, especially its puborectalis part. So this part of levator ani relaxes, and this allows the urination and the defecation process. Now I will tell you the detail of the last muscle of the second group, and that muscle is coccygeus, also known as ischio-coccygeus muscle. So it's located behind the levator ani muscle. In dissection we can see this muscle when we are going to remove sacrotuberous ligament, sacrospinous ligament, and when we are going to identify ischial spine, the muscle that is going to attach over the ischial spine, it is the coccygeus muscle. So it arises from the ischial spine and it is attached to the inferior end of the sacrum and the coccyx. So after covering the detail of muscles of the pelvic floor and the function of the levator ani muscle that I told you, I will tell you some important points that are related to the pelvic floor. So for this, remember the fascia that covers the piriformis, this fascia is thin over there, and the nerves over the piriformis, for example the sacral plexus, it is going to lie external to this pelvic fascia, and of course it is not going to pierce the pelvic fascia when it is passing out from the pelvis because it is external to the pelvic fascia. While the gluteal vessels, these are internal to the pelvic fascia, and therefore when they are piercing the pelvic fascia, and because they are passing out from the pelvis, so the fascia is pierced in that case. So another point is that the parietal fascia over the pelvic floor, it is loosely arranged between the peritoneum and the pelvic floor. And the significance of this loose nature of fascia over that area is it forms a dead space, and this dead space allows the distension of the bladder, rectum, uterus, and the genital structures as well. But remember, due to this loose nature of the fascia, there are also chances of the rapid spread of infections as well. Lastly, if there is injury to the pelvic floor during the difficult childbirth, it can result in the loss of support of the pelvic viscera, and leads to the uterine and the vaginal prolapse or the herniation of the bladder that we name as a cystocele. So in these conditions, whenever there is intra-abdominal pressure and it's going to raise, for example, coughing, dribbling of the urine occur, and this is a common complaint by a patient, and the prolapse can also occur. So that was all about the pelvic floor, its muscle. For next video, I will appreciate if you recommend topic that needs to be clear. Thanks for watching. Don't forget to subscribe.